Hi guys, Dr. Daniel from Green Square Health here. With the current outbreak that's happening in Sydney, there's a few extra things we want to consider with your appointment at Green Square Health. Firstly, if it is at all possible for you to do your consultation over telehealth, we ask that you change your appointment from a regular face-to-face consult to a telehealth consult. This would be most things like repeat prescriptions, mental health care consultations, advice about vaccines, or discussing some things that don't need a physical exam at the immediate time. If you can go onto hotdoc through your website and change it over to telehealth, or if you have to, give us a call and let us know that you want to change it to a telehealth type consultation. We should be able to do most short to long consults over the telephone or via video chat if required. If your consultation does need to be face-to-face, so things like looking at an injury, repairing a laceration, doing cervical screening when it's due, doing a skincare examination if you're worried about skin cancer, and routine immunisations, we ask that you make sure that you don't come if you have any symptoms that could be possibly overlapping with COVID. Things like coughs, colds, sore throat, fever, headaches, loss of smell, etc. We ask that you delay that until you feel better and you've had a negative COVID test. If you are worried about cold and flu symptoms or you're worried about you having contracted COVID, we ask that you do a telehealth consultation first. Your doctors will chat to you about all the symptoms and get a bit more of a clear understanding and history, and then they'll arrange a time so you can come and be seen physically. We're not going to do that in the isolation room in the clinics anymore. We're going to do that at the back of the clinic. So there's an entrance at the back off Powell Street. If you want to drive your car and park there, or if you live nearby, you can walk there and we can do the consultation afterwards. But we only do that when we've pre-planned it. So that's after a telehealth consultation. Okay. If you come to the front and you have these symptoms and the receptionist does ask you, do you have a cough, cold, sore throat, runny nose, fevers? It's quite a long list. You know what they mean. We've been suffering from, the world's known about COVID for a while now. If there's any symptoms that could overlap with COVID, say yes. And we'll do the consultation through the front door. And if it's clear that this is not a COVID-related issue, long-standing chronic sinus issue or something like that, and things are safe, we'll still be able to examine you out the back. Okay, so we're not going to disadvantage you. But if you say no to those and in the consult room you say, oh yes, by the way, I do have a cough, I do have a runny nose, but I don't think it's COVID, we're still going to ask you to go outside. So it's just going to hold things up a little bit more. So just say yes at the front and we'll make sure that everybody remains safe. We're putting chairs along the front of the clinic as well, because we know that COVID transmission does happen more frequently indoors and when you spend more time with people. So once you've let the front desk know that you've arrived for an appointment, we're going to offer you seats outdoors if it makes you more comfortable. We know we're setting records for some of the coldest days in July at the moment. So if you do need to sit inside, if you're with kids, if you're a little bit frail, or you just go, look, I just can't sit outside today, we'll let you come in. That's absolutely fine. But the option is there for you to wait outside if possible. We hope that we all get through this together, and thanks for listening.